we talk about it as a journey because the journey that we're making in this work is also a journey that we're making with the organisation. And there's a bigger picture of a journey going on for many people, moving from one place to another. We also make a journey within this seminar, within the course of the half day that we've got together. So that's why we refer to it as a compassion journey. And I want to welcome you to that. It's really lovely that you could be here. And something I want to be really clear about up front is sometimes when we talk about compassion, that people see that we're doing work with compassion, they can get the idea that we're here to teach them how to be compassionate. And I don't believe that's possible. I think all human beings pretty much have a spark of compassion within them. We all have that within us. And so our work is about helping to unleash that. Because I think, circumstances in life, whether that's in our personal lives or our professional lives, can squeeze that a little. That spark of compassion can get squashed or dulled a little bit by difficulties, life circumstances, systems, the work environment we work within, maybe the bureaucracy or the paperwork. How many people struggle with lots of paperwork. So these things can be factors that can affect our capacity to be fully present and compassionate in each moment. So part of our journey today, one of the ways we talk about it is as a journey from fear to trust. There's a way that our culture at the moment has a kind of prevailing wind of fear. There's lots within the media and the way the media works in terms of advertising and things like that, which is largely fear-based. It's talking about, buy this thing, or you might not get it. There's that kind of quality of fear, and then particularly within the sector that we're dealing with, within health and social care, we've had a lot of reports and things come to the surface in the last few years, which have made it clear that, the upside is that it's coming to the surface. We're finding out the places where things aren't working. The challenge of that is that within the system, that generates a lot of fear. Fear of getting things wrong, fear of being seen to have done something badly, and that fear can get in the way again of actually fully expressing our compassion. It can help us see how we may be able to improve, but it can be a blocker as well. And I think for a lot of people, the fear around getting the paperwork right and making sure the compliance is in place can get in the way of us trusting ourselves, being able to listen to ourselves and be fully present in our compassion day to day. So that's one of the ways we talk about it. It's a journey from fear to trust. Another is a journey from compliance to compassion. So I mentioned compliance there, and I would suggest that it would be easy right now for us to build a culture of compliance. With all the fear that's in the air, with all the problems that we've seen, it would be easy to be working very hard for compliance. And while I think that work is vital, we need to make sure the paperwork happens in the right way. We need to make sure the records are kept. We need to have these systems of checks and measures. I think there's lots of that's healthy. If that's our primary focus, I think that something's gone wrong. My contention and what I'd gently respectfully offer you today is that we need to put compassion at the heart of things and compliance be in service of that. Yeah, so they do need to work together, but the compassion really needs to be at the heart of things. So that's a big part of what we're doing here today. It's not about teaching compassion, it's about having a space where we can really focus on it. And as part of that, a big part of that is focusing on self-compassion. I'll say more about this later, but I would suggest that if we don't take care of ourselves well, we're going to struggle over time to take care of others well. We're just going to run out of juice, we're going to burn out. It's my sense that people working in this industry are often people who tend to be very good at giving and maybe not so good at receiving. Does that make sense? Yeah. So we're going to spend some time reflecting on how we take care of ourselves for the sake of taking care of others, but we really do need to take some time to really consider deeply how do we take care of ourselves as well, so that we can do that beautiful work of taking care of others. Making sense? Fabulous.